Welcome to the Science Whisperer channel, where we share microlearning videos and science concepts. Infection control is vital in preventing the spread of diseases and ensuring the safety of patients. Proper hand hygiene, including regular hand washing with soap and water, is one of the most effective ways to prevent the transmission of germs. Wearing personal protective equipment, such as gloves, masks, and gowns, can help protect healthcare workers and patients from infectious diseases. Regular cleaning and disinfection of surfaces and medical equipment is crucial in reducing the risk of infection. Implementing standard precautions, such as safe injection practices and proper waste management, is essential to prevent the spread of infections in healthcare facilities. Healthcare professionals should follow respiratory hygiene and cough etiquette to prevent the transmission of respiratory infections. Ensuring proper ventilation and airflow in healthcare settings can help reduce the concentration of infectious particles in the air. Promoting vaccination among healthcare workers and patients is important in preventing the spread of vaccine-preventable diseases. Education and training on infection control practices should be provided to healthcare workers to promote compliance and best practices. Surveillance and monitoring of infections in healthcare facilities can help identify outbreaks and implement timely interventions. Adhering to specific transmission-based precautions, such as airborne, droplet, or contact precautions, is necessary to control the spread of specific types of infections. Maintaining a clean and tidy environment in healthcare facilities supports infection control efforts by reducing the potential breeding grounds for germs. Proper isolation measures should be implemented to separate patients with infectious diseases from others. Strict adherence to sterile techniques during invasive procedures is crucial to prevent healthcare-associated infections. Regular cleaning and disinfection of high-touch surfaces, such as doorknobs and light switches, can help reduce the risk of infection. Implementing protocols for the proper handling and disposal of hazardous waste is essential in preventing the spread of infections. Promoting a culture of safety and accountability among healthcare workers is important in ensuring infection control practices are consistently followed. Proper hand hygiene should be practiced not only by healthcare professionals but also by patients and visitors. Educating patients and their families about infection control measures can empower them to actively participate in preventing the spread of diseases. Proper storage and handling of sterile supplies and medications is necessary to maintain their efficacy and prevent contamination. Developing and regularly updating infection control policies and procedures is crucial in keeping up with the latest evidence-based practices. Providing resources and support for healthcare workers to report and address infection control concerns promotes a culture of transparency and continuous improvement. Implementing a multidisciplinary approach to infection control involving healthcare workers, infection prevention specialists, and administrators is highly beneficial. Regular surveillance of healthcare-associated infections allows for the identification of trends and the implementation of targeted interventions. Proper respiratory hygiene, such as covering the mouth and nose when coughing or sneezing, can help prevent the spread of respiratory infections. Healthcare facilities should have clear protocols for managing patients with suspected or confirmed infectious diseases. Proper and timely communication between healthcare workers, patients, and other stakeholders is essential in preventing the spread of infections. Healthcare workers should receive appropriate immunizations to protect themselves and their patients from vaccine-preventable diseases. Using single-use disposable items whenever possible can help reduce the risk of cross-contamination and infection transmission. Regular training on the correct use of personal protective equipment is necessary to ensure its effectiveness in preventing infection. Implementing engineering controls, such as air purifiers and UV light systems, can help reduce the risk of airborne transmission in healthcare settings. Proper management of patients with multi-drug-resistant organisms is important in preventing their spread to others. Patient education on infection control practices, such as cough etiquette and hand hygiene, can help reduce the transmission of infections within the community. Healthcare facilities should have systems in place for the early detection and management of outbreaks to prevent their further spread. Promoting a culture of hand hygiene through visual reminders, such as posters and hand sanitizer stations, can reinforce good hand hygiene practices. Implementing effective antibiotic stewardship programs can help prevent the development and spread of antibiotic-resistant infections. Regular training and drills on infection control procedures can help healthcare workers respond appropriately during an outbreak or emergency. By implementing comprehensive infection control measures, we can protect both healthcare workers and patients from the risk of infections. Thanks for viewing this microlearning video, and don't forget to subscribe for more updates.